Welcome to Risk Assessment Stage 4. As we said earlier, we're going to focus solely on coronavirus or COVID-19 in this stage. Over the next few minutes, we're going to look at understanding the principles of controlling coronavirus and understanding your coronavirus risk assessment procedures. As we plan to open more and more workplaces, employers should be carrying out risk assessments before this even starts. There is a key role for Unite health and safety reps in this process who can help and support employers get it right, because getting it wrong can cost lives. We still use the 5-step risk assessment process. We identify the hazard. Well, we know what it is, COVID-19 or coronavirus. Who might be harmed and how? Well, it's you and it's your work colleagues, but then it's your friends and family and anyone else you come into contact with. How are they harmed? We know from the science that coronavirus is airborne. So coughs, sneezes, or just speaking too close to someone could pass small molecules from you to them, and vice versa. Evaluate the risk and decide if current measures are adequate. Well, most workplaces won't have any measures in place to stop coronavirus spreading. So we look at where we can be contaminated, what control measures we can use, and what else we can do to stop the spread of coronavirus. As with all risk assessments, we need to record significant findings. We need to review and revise if necessary. This should be done on at least a weekly basis. As with all risk assessments, we have a hierarchy of control measures we can use. These begin with elimination, substitution, engineering controls, administrative controls, and finally, the last resort is PPE. We begin by looking at elimination. The first way to eliminate coronavirus is to find a vaccine, but this may be some time off. The second, and this is the government current guidelines, is to stay at home. So, do you really need to return to work? If you can work from home, you should do so. This is the government guidance, and your employer should follow this wherever possible. The next level of control is substitution. What we're trying to do here is reduce the risk as much as possible. So, for example, if we have to have a meeting, does it have to be face-to-face? Or could it be online or by phone? I'm sure we've all used things like Zoom or FaceTime over this period to contact people. This also extends to the workplace. Do we have to do things in the same way? Do we need everyone in the building at the same time? Should we stop visitors from entering the building and just limit it to staff and employees? We will now look at engineering controls. Many of us have been doing this without knowing it. Social distancing, for example, is an engineering control. So you should look at how we can do this in your workplace too. If staff are returning to work, we should consider having them do a self-assessment each morning. Are they feeling any symptoms, a high temperature or a dry cough, for example? If this is the case, then they shouldn't come to work. This is the best way of preventing the spread of coronavirus from even entering the workplace. Another engineering control is to test everybody's temperature before they're allowed to enter the building. We've seen screens go up at supermarkets. We've seen places taped off on buses so that people are not too close together. There are a wide range of engineering controls available to us, and we should explore how these best fit our workplace and our situation. Let's look at some administrative controls. If we do have to have a meeting, for example, that has to be face-to-face, and we've put in place social distancing and other engineering controls, the administrative controls are limiting the number of people to those who really do need to be in that room. Other administrative controls are things like access to your buildings. Do you allow visitors? Do you schedule staff arriving at different times so there isn't a backlog at the clocking on machine or in the canteen? Do you stagger breaks so that you limit again the number of people in a canteen? Do you have skeleton crews that come in and out at different times? If this is the case, it's always good to work in teams. So if one person of a team does get the virus, it's not spread to other teams. These are just some administrative controls you can consider. The final control measure is PPE, or personal protective equipment. We cannot expect people to sit in an office for long periods of time wearing a face mask. This is why PPE is the last resort. There are some things, however, that we can put in place and are essential. These are hand sanitizers and sanitizing wipes. These should be placed strategically. So, for example, either side of doors where you cannot enter or exit without touching the handle. At the top and bottom of stairs, so that you can use a wipe as you go up and down using the banister for support. There should be places to dispose of these items safely, so bins need to be provided at key points. You should consider giving each individual a small bottle of hand sanitizer that is theirs specifically and can be carried easily, or clipped onto trousers or skirts. You should implement a much improved cleaning regime, focusing on hard surfaces and heavy contact areas, such as door handles, filing cabinets, keyboards, phones, and monitors. Wherever possible, you should remove options to hot desk so that individuals don't come into contact with surfaces straight after someone else has. If you cannot avoid doing this, then equipment must be cleaned by the person as they finish using it, and the next person should clean it before they start using it. Finally, if people do have to work within 2 meters of each other, so for example, a task that needs 2 people to carry it out, then a dynamic risk assessment must be carried out before the task starts. This should include the issuing of PPE, such as face masks and gloves, and the time the 2 people spend in close proximity must be limited to as little as possible, wherever possible. And remember, if you do come into contact with surfaces that could have been touched by others, then wash your hands thoroughly afterwards, using either hot soap and water or hand sanitizer where available. Usually PPE is the last resort, but coronavirus is different, so people are being encouraged to wear face masks when in contact with others. In some countries, it's now a legal requirement to wear one when out in public. We are not at that level yet in this country, but it is advisable that if people do want to wear a face mask, they should be encouraged to do so. But it must fit properly. They should change it regularly if it's a disposable one, and if they are disposing of it, to do so in a safe manner. We hope you found this short presentation helpful. There are some useful websites on this page, and we've also put the Unite Coronavirus Risk Assessment Guide in the Useful Documents section. Thank you for taking the time to study this course with us. We hope to see you back here soon, studying something else.